Hello and welcome everyone. This fresh morning, good morning, and a very happy morning. We are all we are all ready for a very important exam in our life, few months from now. So for in that effort, in that endeavor, we are starting this discussion sessions. So today it's ENT. I am your ENT faculty, and I have some very important MCQs. Most of these MCQs are very popular MCQs from the FMG point of view, and they cover a lot of points. So we are not going to beat around the bush. We'll just stick to the core, the important things, academics only. Right. So first question, which of these symptoms is least likely to be present in a patient diagnosed Meniere's disease? So in FMG, as far as ENT is concerned, most of the questions are very direct questions. Like this is a very direct question about Meniere's disease. And so pretty simple ones in most cases. So what is your answer this time? Which of these symptoms is least likely to be present? Is it episodic vertigo, otalgia, fluctuating hearing loss, tinnitus? So before I give you the answer, once again, very happy Doctor's Day to everyone. Young doctors you are. We are on the older side. We are the young doctors, the future doctors. A very happy Doctor's Day. So now Meniere's disease is an inner ear disease. In inner ear, the combination of symptom for inner ear, most of the inner ear disease, the combination of symptoms are SNHL, which is sensory neural hearing loss, vertigo. These are the two most important symptoms, and tinnitus, nystagmus, nausea may also be there. Right, tinnitus, vertigo, nausea. But inner ear does not have pain fibers, and that's why even if there is an inflammation in the inner ear, pain is unlikely to happen. We all know when there is inflammation in any part of the ear, one of very important symptom in inflammation is pain, isn't it? Inflammation ko to pain hoga hi. But inner ear does not have pain fibers inside. Outside mein hota hai, not inside. So if there is a disease inside the inner ear, pain is a very unlikely symptom. So Meniere is an inner disease. Pain means otalgia, wo nahi hoga. Second point is Meniere's is not an inflammatory disease. वैसे inflammation है ही नहीं. So Meniere's cannot have pain for two reasons. A, because it is not an inflammatory disease. Non-inflammatory disease में pain होने के chances बहुत कम होते हैं. And second is inner ear diseases usually do not have pain. So for that reason, ear pain, which means otalgia means ear pain. Otalgia means ear pain is unlikely to happen. So yes, most of you have answered. Aman Singh, Anuridh Sahani, Pranavi Reddy, Vipul Sukla. Everybody who has answered, 4 people, they've all got it right. Great. Now, what are the symptoms of Meniere's disease? See, these are the main symptoms and signs of Meniere's disease that you have to know. So if you notice, like I told you, because it is inner ear disease, it tends to have tinnitus, SNHL, vertigo, nausea, and nystagmus. These are the symptoms that happens to every inner ear disease, including Meniere's disease, because it is an inner ear disease. Now, so if the patient has this symptom, these things, now how do you know it is in Meniere's disease? Because like I said, every inner ear disease has the same symptoms. So how do I know it's a Meniere's disease? Different from any, like labyrinthitis will have the same thing, you know. So the main thing that can differentiate Meniere's from any other inner ear disease are these two words. One is this word called fluctuating. Meniere's is the only disease which has fluctuating hearing loss and fluctuating tinnitus, and vertigo has episodic vertigo. So if you go back to this question, not only they are saying this patient has vertigo and hearing loss, they are also telling you that hearing loss is fluctuating episodic vertigo is fluctuating. So this tells me this is definitely a Meniere's disease patient, but there's never a doubt because in the question they tell you, but I'm telling you. And these are the special features or signs of Meniere's disease. Very, very popular MCQ: Hennebert sign, Tullio's phenomena, Diplaccusis, recruitment, SI. Just remember these names. Now, for your information, for those who don't know, in 2023, in one of your FMG exams, they'd asked what is Tullio's phenomena. This was an MCQ in your FMG exam in 2023. So anybody who knows what is Tullio's phenomena, please write in the comment. Let's see. I will tell you, but anybody who knows what is Tullio's phenomena, because this was asked in your exam, like I said, few years back. Anybody? Tullio's phenomena. When loud sound, loud noise, loud sound produces vertigo. So patient tells you that every time there is a loud sound, my head starts spinning, I get imbalance, I feel I will fall down. That's called Tullio's phenomena. Hennebert sign is the other name for false positive fistula sign. False positive fistula sign is Hennebert sign. Diplaccusis, the patient hears double sound. Dipla means double. So every word that you speak, patient hears 2 times each. So that's diplaccusis. And these two are features of Meniere's disease. Just remember them. Okay, so these are some of the other important points about Meniere's disease. And Suvo got it right when he said loud sound produces vertigo. Absolutely correct. Great. And then we'll go to the next question, question number 2. A 9-year-old boy comes with complaints of right ear pain, difficulty in opening the mouth, painful swallowing, fever. Now, if you look at the history, there are 3 things this is telling you. A, there is some ear complaint, कुछ ear में हुआ है, isn't it? Then something in the throat, difficulty in opening the mouth, painful swallowing. So something in the throat, and fever tells you that there is some kind of a inflammation. So throat में कोई inflammation है, because of which there is throat pain and difficult to open the mouth with ear pain. Now, before I go on to the question, what is a technical clinical term when there is difficulty in opening the mouth? What is this condition called? If the mouth is not able to open properly, what is that condition called, guys? उसका नाम क्या है? Anybody wants to tell me? It's trismus. Trismus means difficulty in opening of the mouth. I'm sure most of you know this. Common term is lockjaw. Lockjaw is a common term. Trismus is a more technical term. The oral cavity examination reveals the following. You can see the image. And facial examination is unremarkable. That is normal. So what is the likely diagnosis? Now see, parotid abscess is an abscess of the parotid gland. This causes parotid pain. In parotid abscess, there is nothing inside because parotid is outside swelling. So all the symptoms are outside symptoms. So this patient will not have dysphagia, difficulty in swallowing, trismus. These are unlikely to happen in this patient. Bezold's abscess is an abscess in sternocleidomastoid muscle. Again, it is swelling outside. You can, in these two, nothing is inside. All the findings are outside. In this case, it says face outside is unremarkable. So these two cannot be there because in both these cases, there is swelling outside here or here. Now, pharyngitis is a possibility. But in this case, you can see the tonsil, the image is showing you. If you look only at the history and without the image, then both are correct answer possible. This is possible and this is possible from the history. In pharyngitis, everything is possible that is given. In Quinsy also, everything is possible that is given. So what will differentiate from pharyngitis from Quinsy in this particular case is the image. If you look at the image, the arrow is clearly showing tonsil on one side is enlarged, post, and that means this is something to do with tonsil. Either it is tonsillitis or something related to tonsil. Since tonsillitis is not given in the choices, tonsillitis दिया नहीं हुआ, तो वो हो नहीं सकता. So what is left is Quinsy. So Quinsy is the correct answer in this particular case. So lot of good a lot of you could answer this correctly. Almost Aman Singh, Vipul Shukla, Shuvo, Sakshi, Ranjan, and Dipanshu clearly defined trismus, inability to open the mouth. So many of you could. And Ranjan Sahani is saying that this is ear pain is a referred pain. That's a very correct statement. Whenever you have a tonsillitis, tonsillectomy, anything in the oropharynx, due to ninth nerve, there can be a referred pain because tonsil is supplied by ninth nerve, glossopharyngeal nerve, and middle ear is also supplied by glossopharyngeal nerve. So because one side tonsil has a problem, through that ninth nerve, the pain can be referred to the middle ear. Now, like I was telling you a little while in the previous question, that middle ear does not have pain fibers. Inner ear does not have pain fiber. That's why inner ears inflammations, diseases usually do not cause pain. Middle ear has a lot of pain fiber. Which is the pain fiber? Which is the nerve that carries the pain fiber of the middle ear? Ninth nerve. That's why if there is any involvement of the ninth nerve in any part of the body, ninth nerve is a long nerve, supplies so many things. So if there is any involvement of the ninth nerve, they can cause referred pain to the ear. In this case, oropharynx, the entire oropharynx, which includes tonsil, is supplied by the ninth nerve, and that's why there is a referred pain in the middle ear in this case. That's the reason of pain in this case. Very good. Absolutely correct, Ranjan Sahani. So these are the other points about Quinsy. Quinsy is a very important topic. We have more than one question. We have more question on Quinsy if you as you proceed. So Quinsy is caused by strep pyogenes. Strep pyogen belongs to a group called group A beta hemolyticus streptococcus. In short, we call it GABHS. So if you read the pathogen causing Quinsy and tonsillitis, answer is the same. Strep pyogen or GABHS, both are correct answer. Now in this case, the pus accumulates between the capsule and the superior constrictor muscle. This was a question asked once, that in Quinsy, where does the pus accumulate or collect? Between the capsule and the superior constrictor muscle. Now superior constrictor muscle is also called the bed of the tonsil. This space is called peritonsillar space. What is the area called? Peritonsillar space, and the abscess of the space is called Quinsy. So it can also be called peritonsillar space abscess. There is other name for this cases. Now Quinsy is a very painful disease in the throat, and that's why it is compared to a hot potato condition. As you can see, it is described as hot potato condition. And muffled voice. What is a muffled voice? When you try to speak with food in your mouth, when there is a food in the mouth and you try to speak, that voice is called muffled voice. And what is the treatment? Immediate incision and drainage followed by interval tonsillectomy. And what is interval tonsillectomy? Tonsillectomy done after 6 to 8 weeks is called interval tonsillectomy. Like I said, because Quinsy is a very important topic, we have more questions on Quinsy. और ये slide देखने के बाद बाकी जितने भी question you can answer all the questions without any problem. And then we go to another question. Now this question was also asked, similar question was asked recently in your exam. So a 40-year-old woman present with mild progressive bilateral hearing loss. A pure tone audiometry showed the following finding. What is the most likely clinical finding in this patient? Pure tone audiometry is shown. Is it Hennebert sign, Histelberger sign, Schwartz sign, Bayer sign? So a lady has hearing loss in both the ears. That's the only history they're telling you. And the audiogram. Now what do you see on the audiogram? Audiogram is in a type of graph. We cannot discuss audiogram here, but in the lectures we try to tell you basics of audiometry. Now this is a very special audiogram. Two things that you can note or see in this audiogram. Let me enlarge this. What are the two important findings in this audiometry? Number one, see, this is 20 hertz, this is 30 hertz. दोनों के बीच में 25 होगा. So if I draw a line between 20 and 30, it is going to cut through 25. है ना? Now in audiometry, this line that I have drawn at the level of 25 decibel hertz is a very important landmark. अगर ग्राफ इस लाइन के नीचे जाता है तो पेशेंट को हियरिंग लॉस है. If the graph is not going below the 25 mark, there is no hearing loss. So in this particular case, a graph is going below 25. So this patient definitely has a hearing loss. वैसे we don't have to know this because it's already given in this question also. The patient has hearing loss. And so by looking at the graph also, we know there is hearing loss. If the graph is below 25, hearing loss जरूर है. Only one graph, not both. See, the other one is above. So this is conductive hearing loss. So one thing is sure, this patient is having conductive hearing loss, which is what Ranjan Sahani has said. The second important finding is that in the normal graph, this graph which is above the 25 mark, there is a very interesting finding. At 2000 Hertz, there is a sudden dip. इस तरह से dip जाता है. Suddenly it going down. And this sudden dip at 2000, as many of you are saying, is called Carhart's notch. So this finding is called Carhart's notch. So if I ask you what are the two important findings in this particular audiogram, you say two important findings are: one, it is conductive hearing loss; B, there is a Carhart's notch, and Carhart's notch is seen in otosclerosis. So this patient is suffering from otosclerosis, and because of otosclerosis, this patient is having conductive hearing loss. This is what you have to know. So what are the, now they are asking you basically to make a diagnosis by looking at this graph and the history. You have to make a diagnosis. Diagnosis history पढ़ के नहीं पता चलेगा, diagnosis audiogram से पता चलता. Otosclerosis, history is telling you hearing loss है, and in the lady. Now that can happen in many other conditions also. So the audiogram is telling you it is otosclerosis because there is Carhart's notch. Okay, so indirectly they are asking you otosclerosis में इनमें से कौन से feature हो सकते हैं. Hennebert sign we just discussed is a feature of Ménière's disease. ये Ménière's में होता है ना, याद है? Ménière's in, I told you, Hennebert sign, false positive fistula sign. Hestelberger sign is seen in acoustic neuroma. ये acoustic neuroma की find है. And Bayer's sign is a neck disease. It is not ear disease. It is a throat disease. It is seen in laryngocele. Laryngocele, which is a throat disease, will have Bayer's sign. So these three are not seen in otosclerosis. What is that? Schwartz sign. So Schwartz sign, C is the correct answer. And I think many of you have answered. Vipul answered correctly. Sue answered correctly. Aman Singh, Ranjan Sahani, Anuruddh Sahani. Many of you have been able to answer correctly. Very good. Great. Now, these are the other important points about otosclerosis. Although in that question, the age of the lady given was 40, but in otosclerosis, it is very common to have a patient at around 35 years, and usually the lady is pregnant when they present with otosclerosis. In this case, it was not pregnancy, but still it is okay. But what was common? Progressive conductive hearing loss. That was given in that book, progressive hearing loss. Rarely there can be SNHL, and two signs. One is paracusis villisi and one is Schwartz sign. So this was given in the choices, and this is the correct answer in this patient. So, and you have to know the meaning of these two signs also. Most of you know, I'm sure. Paracusis villisi is better hearing in a noisy area. That means a patient of otosclerosis, they have hearing loss. So if you talk to them normally, they will complain of hearing loss. They'll say, I can't hear. But when they go to the noisy area, their hearing becomes better. So better hearing in the noisy area is paracusis villisi. And Schwartz sign is pink membrane. The membrane becomes pink. Normally the membrane is pearly white. In this case, it becomes pink. So that is, so these are the additional features of otosclerosis that you have to know. Next one, a man who works in cattle range presented with complaints of a mass protruding from the left nostril with blood stains nasal discharge. The mass is pink, leafy, polypoidal, so deep red in color, pink, and is attached to the nasal septum. Biopsy from this lesion showed several sporangia. Now this is the diagnostic thing. See, because nasal mass from the in anybody is common thing. This is a red mass. Most of the nasal mass are red in color. The only mass of the nose which is never red in color is nasal polyp. So from the history, the only thing we know, there is a nasal growth and it is not polyp. Polyp नहीं हो सकता, polyp pale होता, red नहीं होता, bleed नहीं होता उसमें से. Okay, and उसके अलावा कुछ भी हो सकता है. Now, what is the treatment of choice for this condition? So, what is giving you the diagnosis? Sporangia. If a nasal mass has sporangia on histopathology, then this is rhinosporidiosis. Rhinosporidiosis. In rhinosporidiosis, what is the treatment? Now, tetracycline streptomycin, it is used for rhinoscleroma. This is a treatment for rhinoscleroma, not for rhinosporidiosis. Radiotherapy is used for tumors carcinomas. This is not a tumor, this is an infective disease, so it's not, radiotherapy is never given. And you can two things that you can do in this patient in rhinosporosis, you can exercise with the cautery and you can also give dapsone. Now both are correct statements, both are correct answers, ये दोनों करते हैं, ठीक है. Now you have to pick the treatment of choice about the condition. Now dapsone will kill the pathogen, पैथोजन ठीक हो जाएगा लेकिन वो ग्रोथ खत्म नहीं होता. And for to remove the growth we have to do excision. So in this case both are correct answer. Excision of choice, treatment of choice is excision with the cautery. And why do we use cautery? क्योंकि bleeding हो रहा, तो to decrease the bleeding. So C is the correct answer. D is also correct. If they ask you the drug of choice, then D. But if they ask you the treatment of choice, C is a better answer than D. So in this case, C. So these are some of the questions which can be confusing. इस तरह के question थोड़े से confusing हो सकते हैं. Okay. So these are the other points about rhinosporidiosis. You can see it is called by Rhinosporidium sebarii. This is a protozoa, so it's an infective disease, not a tumor. इसलिए radiotherapy नहीं हो सकता. In southern India, it is seen in coastal areas. In northern India, it is in farmlands and ponds. So cattle, वो है ना cattle farm. So farmlands में होता है, cattle range में. And because it's red in color, deep red in color, pink color, इसलिए इसको strawberry polyp बोलते हैं. Histopathology, I will tell you. Treatment C, cautery excision and dapsone, both are correct answers like I told you. But in this case, because they are treatment of choice, this is a better answer. And then what happened? चिपक गया. One second, guys. This is the other point, other features about this particular disease. One second, let me restart. Something went wrong. So this is the next question. You are an intern performing the tuning fork test on a patient who presented with ENT OPD with complaint of decreased hearing in the left ear. So there is a hearing loss in one side. Which of the following tuning fork is the most commonly used for routine clinical assessment for such a patient? Basically, it's a very straightforward, simple question. Which is the most commonly used frequency in a tuning fork? So what is your answer, guys? Very straightforward, simple. Either you know or you don't know such questions. Hai na? So the most commonly used frequency in a tuning fork is 512 hertz. Straightforward. Now why 512 hertz? बाकी ये सारे use हो सकते हैं. But this is the most popular used tuning fork because this is best heard. In बाकी में से compared to rest of them, this is heard the best and it has less vibration also. Vibration कम होता है फिर भी ज़्यादा सुनता है, इसलिए इसको यूज करते हैं. Next question. What is the shape of septal cartilage? Is it quadrilateral, triangular, hexagonal, circular? Circular we all know. Quadrilateral is a structure which has 4 walls like this. We know this. Triangular is a structure which has 3 walls like this. And hexagonal is a structure which has 6 walls like this. So basically, many structures, the names are based on the shape. So if I name something quadrilateral, उसका नाम quadrilateral तभी होगा जब उसके 4 वॉल होगी. And nasal septum has 4 walls, and so it's called quadrilateral cartilage. Suvo, Sakshi, Aman, Vipul, Anirudh, Ranjan, all got it correct. Very good. And this is how the nasal septum looks like. Now nasal septum has 7 bones plus 3 cartilages plus a membrane also. So बहुत सारी चीजें होती है nasal septum में, but you have to identify 3 out of the lot. You should be able to identify this thing which is called vomer bone. You should be able to identify this ethmoidal bone, and this is the cartilage they are talking about. Now this is the quadrilateral cartilage. See, one wall is this wall, second wall is this one wall, second wall is this wall, third wall is this wall, and fourth wall is this wall. So these are the 4 boundaries. That's why it is called quadrilateral cartilage. इसका नाम ही है quadrilateral cartilage. Okay, so easy. Then the vertical fracture of the nasal septum is known as, this question was asked last year, not in your exam, in NEET PG. NEET PG में last year ये question आया था 2024. That what is the vertical fracture of the nasal septum called? I think it's a very straightforward. Is it a Savlet fracture, Sitlis fracture, tripod fracture, or Jara-Javé fracture? Now, Savlet fracture is the correct answer. This is the vertical fracture of the nasal septum. Now, tripod fracture is fracture of anybody? Fracture of zygoma. If the zygoma has a fracture, that becomes tripod fracture. And Jara-Javé is horizontal fracture of the septum. Same septum, if the fracture is horizontal, then it becomes Jara-Javé fracture. Now zygoma is this bone, if you can see my face, and because zygoma is made up of the 3 joints, there are 3 joints in the zygoma, so they get separated. Tri means 3 bones से बनता है, इसलिए tripod fracture उसका नाम है. Okay, so a lot of you got it correct. Ranjan, Suvo, Barolkar, Anirudh, Aman, Dipanshu, yes, lot of it. So Anirudh also note zygomatic fracture is called Jara-Javé fracture. That's very good, great Anirudh. Zygomatic fracture is Jara-Javé. Very, very good. Absolutely perfect. Now look at these 2 images. Now these are both septums, and this dotted line is trying to show you the direction of the fracture line. Now this is Savlet fracture, because as you can see it is going horizontal, the fracture line. So this is how the Savlet fracture looks like. And the next one, it is more horizontal. So this is how a Jara-Javé fracture looks like. Savlet fracture, Jara-Javé fracture. Very easy, very simple, straightforward. याद रखना है. Now, next question. A 7-year-old child was brought to hospital by his mother with complaint of sore throat, earache, and pain on swallowing for 3 days. So it's acute disease of the throat. कोई throat में है जिससे pain होता है अंदर. On examination, the tonsil were enlarged and hyperemic. Which are the most common diagnosis implicated in the condition? So see, what they are telling you कि tonsil में कोई problem है, and there is an inflammatory condition in the tonsil. And if there is an inflammatory condition in the tonsil, because in a 7-year-old child tumor वगैरह तो हो नहीं सकता, lymphoma, carcinomas, these are unlikely at this age group. So if a child has pain in the throat, difficulty in swallowing, and tonsil is inflamed and enlarged, straightway what comes to your mind कि tonsil में कुछ problem है, and it cannot be malignant or neoplastic disease इस age में नहीं होता, because neoplastic can disease of the tonsil also can cause same thing, pain and enlargement and congestion, उसमें भी हो सकता है, but in this child it is not possible. So if an inflammatory condition is in the tonsil, दो ही चीज होती है, either tonsillitis or Quinsy that we discussed. In both these conditions, Quinsy and tonsillitis, the presentation is very similar. देख के समझ में आ जाता है कई बार. So the image is not shown, it is only described that it is enlarged and inflamed tonsil. So for us, both are possible, and they are asking the pathogen. Now the interesting thing is, a tonsillitis or Quinsy का main pathogen same होता है. So whether it is tonsillitis or Quinsy, the answer is the same, because the pathogen is same. Why is the pathogen the same in tonsillitis and Quinsy? Because Quinsy is usually a complication of tonsillitis. पहले tonsillitis होता है, फिर Quinsy होता है. That's how the sequence happens. Tonsillitis, and this complicates to become Quinsy, peritonsillar abscess. So the pathogen is the same pathogen goes inside and becomes Quinsy, right? So basically, which is the pathogen in tonsillitis, which is the pathogen in Quinsy, is the same answer. And since I told you the pathogen in Quinsy, you remember already, it has to be by and large the same answer. And I told you beta hemolytic streptococcus, the main pathogen inside in this group is strep pyogen. And I told you that दोनों में से जो भी क्वेश्चन दिया होगा, both are correct answers. In this case, beta hemolytic streptococcus is given and strep pyogen दिया होता तो वो भी correct answer होगा. Okay, so yes, Vipul, Ranjan, Velu, Murugan, Sakshi, Anuruddh, Aman, everybody got it right. Great, guys. Now, they are asking you which is the most common organism implicated in this condition, and we have to pick the answer out of the choices given. इसके बाहर से तो हम आंसर निकाल नहीं सकते, चॉइस में से निकालना पड़ेगा. And the answer that we have given is hemolytic streptococcus, है ना, beta hemolytic streptococcus. But tell me, is beta hemolytic streptococcus, meaning strep pyogen, is the most common pathogen causing tonsillitis? The answer is no. Actually, the most common tonsillitis is a viral condition. Most of them are viral inflammations, usually caused by adenovirus. अगर इसमें adenovirus दिया होता, तो that would have been my correct answer, right? But like I told you, tonsillitis can cause Quinsy. This is only possible in bacterial tonsillitis. In this one, strep pyogen. Viral tonsillitis में Quinsy नहीं होता, because Quinsy means peritonsillar abscess, और abscess में pus होना चाहिए, purulent collection, isn't it? And purulent collection is formed only by bacteria. Viruses cannot cause purulent collection. Pus virus से नहीं बनता. It many times happens, there is a viral infection, then there is secondary bacterial infection. So secondary bacterial infection से pus बन जाता है, but virus by itself cannot produce pus. So once again, let me clarify what I told you. The most common condition causing tonsillitis is a virus, which is adenovirus. It's called viral tonsillitis. The second most common pathogen causing tonsillitis is this one, strep pyogens. So if I ask you which is the most common bacteria causing tonsillitis, strep pyogen is the correct answer. But virus is more important. Out of viral tonsillitis and bacterial tonsillitis, Quinsy is only possible in a bacterial tonsillitis. It is not possible in a viral tonsillitis, right? Now I have to tell you this because when I read this question, I told you question पढ़ के दोनों ही possibility है, Quinsy भी possibility है और tonsillitis भी possible है. Now if it is Quinsy, then strep pyogen is the only correct answer. Virus नहीं हो सकता. If it is tonsillitis, then virus is a better answer. तो अगर इसमें वायरस भी दिया होता चॉइस में एडिनोवायरस, तो हमारे लिए थोड़ी सी catch-22 situation हो जाती है. It's a tricky situation. Now should I pick virus or bacteria because it is only tonsillitis. But since virus was not given in the choices, our job became easier. But talking about tonsillitis, there are many other bacteria pathogen that can lead to tonsillitis, and these are the few important pathogens that you should remember. See, tonsillitis can be infective and non-infective. See, infective tonsillitis, adenovirus. I already told you that this is the most common cause of tonsillitis, and GABHS is the most common bacterial tonsillitis, and this is the answer that we picked also. The rest of them are very uncommon, whether it is Epstein-Barr virus, bacteroids, fusoformis, or non-infective like SLE and Steven Johnson. They can also cause non-infective inflammation, but they are very, very, very rare. Possible, लेकिन practically नहीं होता. Okay, so these are the main points about tonsillitis inflammations. A worried mother brought her 4-year-old son to emergency room with complaint of nose bleeding. So simple case of epistaxis. On examination, the bleed was found to be from Kisselbeck's plexus. A very important name, Kisselbeck's plexus. I'm sure everybody knows this. Now, which of the following arteries does not contribute to its formation? Sphenopalatine artery, greater palatine artery, anteethmoidal artery, posterior ethmoidal artery. So, which of the following artery does not form Kieselbeck's plexus? So, this is a very simple question. I think most of you can answer this question. Let's see. बेसिकली सिंपल क्वेश्चन है, Kieselbeck's plexus में इनमें से चार में से कौन सी आर्टरी नहीं है, पार्टिसिपेट नहीं करती. So come on guys, please answer this question. Yes, Ranjan is saying D. This is the correct answer. So these three plus superior labial artery. These are the four arteries that participates in the formation of Kieselbeck's plexus. So yes, Ranjan, Aman, Anirudh, TJ कौन है ये, विपुल, दीपांशु, D. Okay, Ranjan Sahani and VM Patidhar, your answer is wrong. Greater palatine is not a correct answer. Posterior ethmoidal artery is a correct answer. Okay, now if you look at this image, this is how the septum with arteries look like, and this ring that you see is a Kieselbeck's plexus. Now anteethmoidal artery is this one, it is participating greatly. Sphenopalatine artery is this one, it is participating, and greater palatine artery is this one, it is participating. These three are there, and the other artery is this one, superior labial artery, is also participating. So the artery that is not participating in the Kieselbeck's plexus is this one. This is not the part of the system. Okay. Now epistaxis is a very, very important here topic. I'll tell you epistaxis. Most common cause is nose picking. If nose picking is given in the choices, then this is a correct answer. Otherwise, trauma, you can say trauma. Most common site, either Little's area or Kieselbeck's plexus, same thing. Artery of epistaxis, sphenopalatine artery. That means out of the four arteries, this is the main artery. They can all contribute to the bleeding for all four of them except posterior ethmoid. But the main artery that bleeds is sphenopalatine artery. And the first thing that I do to stop the bleeding is apply pressure. It's called nose pinching. Nose pinching is the first thing, and if the conventional treatment fails, we do ligation of sphenopalatine artery. These are the important, very important gross points about epistaxis that you might want to remember. Right. Next, in a patient with recurrent peritonsillar abscess, when is the ideal time to perform tonsillectomy? Because we have discussed this topic, we know already that peritonsillar abscess is the other name for Quinsy. Dipanshu Modanwal, the pinching is done for 5 to 10 minutes, not 2 to 3 minutes. That's a wrong answer. 5 to 10 minutes. Okay, see, we are waiting for the clot to form. Pinching क्यों करते हैं in bleeding from any side? So that the clot will form and the bleeding will stop. The minimum clotting time on an average is 4 minutes. 4 minutes. So आप 4 minutes से कम pinch करोगे तो रुकेगा नहीं वो bleeding. So you have to pinch for more than 4 minutes. So 2 to 3 minutes is not correct answer. Vipul Shah says 6 minutes. That is accepted. उसने निकाल लिया अपना question. Okay, 6 weeks. Yes, in this case, 6 weeks. I already told you, Hana, in one of the previous question, that in Quinsy we do immediate IND, and interval tonsillectomy is a tonsillectomy done after 6 to 8 weeks. 6 weeks is the correct answer. 8 weeks is the correct answer. अगर दोनों में से एक select करना हो तो 6 is a better answer. But 8 was not given in this, so straightway 6 weeks, simple question. Okay. So this because we had discussed already. So everybody, Aman, Ranjan, Barolkar, Anirudh, Shuvo, Dev Yadav, everybody got it right. Very good. Great, guys. Let us now go to the next question. What is the gold standard investigation to confirm acoustic neuroma? Is it CT scan? Is it gadolinium enhanced MRI? Is it X-ray? Is it biopsy? Now, acoustic neuroma is a benign tumor of 8th nerve. It's a benign tumor of 8th nerve. So I can see Aman is saying B, Ranjan is saying B, Shuvo is saying B, Vipul is saying B, Shakshi is saying B. Everybody who has answered is B, and B is the correct answer. See, any benign tumor, you should do two things. One is a biopsy, because that will confirm, which is done for histopathological examination, and some kind of scan, either MRI or CT scan. One of the two scans is usually preferred in benign tumor. Now, in acoustic neuroma, biopsy is not possible because this tumor is inside the brain, deep in the brain, in cerebellopontine angle, CP angle बोलते हैं, वहाँ पे होता है, and वहाँ पे biopsy is very difficult, nearly impossible. So in this case, the diagnosis is done only by MRI, gadolinium enhanced MRI. B is the correct answer. But there is no confusion about this because biopsy is not given in the choices. In other tumors, benign tumors, if you select which is the investigation we should do to confirm, then histopath becomes a better answer because histopath is better going to confirm the diagnosis. Histopath से आपको ये पता चलेगा कौन से वाला ट्यूमर है. स्कैन, कोई भी स्कैन, MRI या CT स्कैन, दे विल ओनली शो यू कि ट्यूमर का कंसिस्टेंसी कैसे है, कहाँ पे, कितना बड़ा है, the spread and all that. Scans are not very good for making diagnosis, isn't it? So, but in this case, in acoustic neuroma, biopsy is not possible. A. B. It is not given in the choices, so हमारा problem ही खत्म. Now, these are the other important points about acoustic neuroma. As you can see, most commonly it arises from inferior vestibular nerve. Inferior vestibular nerve is a branch of 8th nerve. इसलिए इसको हम 8th nerve tumor बोल देते हैं. 8th nerve tumor is a broad information. If you want to go into the nitty-gritty, inferior vestibular nerve. आप कहाँ रहते हो? इंडिया में रहते हैं, सही बात है, इंडिया नो. लेकिन if you say Delhi या मुंबई या whatever you are staying in your town, that's more precise information. So 8th work is like, if you say 8th nerve, is like saying I'm in India. If you say inferior vestibular nerve, it's like saying the name of the state. So वो और precise answer हो जाता है. And the second important point is the site. It is most commonly seen in cerebellopontine angle, जिसको CP angle बोलते हैं. And this area lies deep inside the brain. And so to know where this area is, look at the image MRI. This is the gadolinium MRI. In short, we call it GD MRI. And that white thing is a tumor. And you can make out that is almost in the center of the brain. है ना? एकदम brain के बीच में है. This area is called CP angle. That's why I told you biopsy is very difficult, impossible. अगर आप इसमें biopsy लेने की कोशिश करोगे तो कुछ ना कुछ complication हो जाएगा. Right? There's one more question about this disease, I think. तो और बातें तब करेंगे. We'll discuss more points about this tumor later on because we have more questions from this disease. Next question. In the examination of a patient with facial palsy, the Schimmer's test was positive. Involvement of which of the following branches of the facial nerve is responsible for this? Now, Schimmer's test ये ophthalmology में होता है. In Schimmer's test, I'm sure you know this from your opthal, that we put a small strip of like a blotting paper in the lower eyelid, and वो tears होते हैं, because it's a blotting paper, it will absorb all the tears, and you can see the water mark, the fluid mark in this blotting paper. दोनों तरफ करते हैं, and usually we compare. If the tears production is less on particular ear, उसमें वो watermark छोटा होगा. So you can make out that the tears are not being produced properly. So tears Simmons test is basically telling you the tears production is normal or not. And if the tears production is not normal, either the tear gland which is called lacrimal gland में problem है, या उसकी nerve supply में problem है. दोनों में से either nerve supply or the gland itself is problem. Okay. In this case, we are talking about nerve. Facial nerve की बात हो रही है, so obviously they are talking about nerve. Now, if Simmons test is positive, means the tears production is not proper. इसका मतलब वो ब्रांच जो tears production में काम आता है उसमें प्रॉब्लम है, and the branch that is controlling the tears production is the greater superficial petrosal nerve. So Aman Singh is right, Suvo is right, Anirudh is right, Ranjan Sahani is right. Cauda tympani is a branch. This supplies lacrimal gland. They all branches of facial nerve, not all. The first three are branches of facial nerve. The first one supplies lacrimal gland. Nerve to stapedius supplies stapedius muscle. Yes, this is the first branch, Suvo. Absolutely correct. This is the first branch. Cauda tympani supplies taste buds on anterior 2/3 tongue. Okay, these are the three branches of the facial nerve. Lesser petrosal nerve is not the branch of facial nerve. तो ये तो आंसर हो ही नहीं सकता है ना. Lesser petrosal nerve. Lesser petrosal nerve is a branch of tympanic plexus. It's a branch of tympanic plexus. It mainly carries the fiber of the ninth nerve. Mainly, इसमें और fibers भी होते, predominantly ninth nerve. And the main thing it supplies parotid gland. ये parotid gland को supply करता है mainly. This is the main purpose. Okay, lesser petrosal nerve. So now talking about facial nerve, this yellow thing that you see is the facial nerve. Now facial nerve का GSPN first branch arises from here. From here is the first branch. This is GSPN. First branch, greater superficial petrosal nerve, and this supplies lacrimal gland. So the tears production is not happening, most probably this branch is gone. The second branch of the facial nerve, which is called nerve to stapedius, I already told you supplies the stapedius muscle, is from here. This is nerve to stapedius. It supplies the stapedius muscle. And the most popular branch of the facial nerve is cauda tympani. And cauda tympani arises from here. And like I said, cauda tympani supplies what? Taste buds. Can you tell me what else does cauda tympani supply besides taste buds? Cauda tympani और क्या supply करता है? Please write in the comment. Cauda tympani besides taste buds supplies few more things, and I want to know what else does cauda tympani supply. What else? इसके अलावा क्या? Anybody? Plus submandibular gland, plus sublingual gland. So Ranjan seems to have revised her subject very nicely, been able to answer till now. I think you have answered all the questions correctly. Now these are the other branches of facial nerve. Facial nerve के सारे branch के नाम यहाँ पे दिए हुए हैं. All the branches you can see. I have mentioned this branch, I have mentioned this one, I have mentioned this one, but इसके अलावा भी facial nerve में और branches होते हैं, as you can see. So if you're interested in knowing the branches of the facial nerve, you can see the entire list here. So Vipul says it provides secretomotor innervation to submandibular sublingual gland. Absolutely correct, Vipul, absolutely correct. And if you could add pre-ganglionic fiber, और अच्छा हो जाता. It supplies pre-ganglionic secretomotor innervation to these two glands. Would have been better, but this is also great answer. Next question. A teenage boy suffered trauma in the left eye while playing cricket. बहुत लोगों को चोट लगती है आँख में. Especially I remember when you are doing wicket keeping, अचानक से बॉल आती है when the batsman misses and it often hits the face and the eye. मेरे साथ हुआ है. That's how I remember. I also had a big trauma in my eye when I was a kid. I was trying to be a wicket keeper, bad wicket keeper. That's why I got hit. So this is quite possible. I did not have this fracture, but I had a trauma. He is rushed to emergency room in severe pain. His X-ray appears to be shown below. So what is this sign? This is a blowout fracture. What is blowout fracture? Blowout fracture is a fracture of the floor of the orbit. And in blowout fracture, there is teardrop sign. So this thing that is hanging in the orbit, from the orbit into the maxilla, looks like a drop of tear. So teardrop sign, absolutely correct. Everybody who has been able to answer is correctly. Now Phelps sign is seen in glomus tumor. This is a, and teardrop sign is blowout fracture. Holman-Miller sign is seen in juvenile nasopharyngeal angiofibroma, and antral sign is also seen in juvenile nasopharyngeal angiofibroma. So except this sign, all the signs are seen, other signs are seen in tumors, and they are not talking about tumor, they are talking about fracture. अगर आपको नहीं भी पता होता कि in this fracture, in this trauma, what is the sign called, if you know these three names because they are all seen in tumors, you know कि ये tumor तो है नहीं, तो और कोई sign हो नहीं सकता. So it's a easy, simple question. That's why almost everybody answered it correctly. A 5-year-old child is brought to you with complaint of noisy breathing. On performing direct laryngoscopy, subglottic stenosis was noted. Which grading system will you use to report the extent of the stenosis? Basically they are asking you stenosis, subglottic stenosis का grading, और ये question आपके एग्जाम में आ चुका है. This question has been asked in your exam in the past. दीपांशु आइस कोन क्या बोला तुमने? आइस कोन तो MRI, वो गैडोरिनियम MRI इन कॉस्टिंग वो था आइसक्रीम कोन, not this one. So like I said, all this grading has been this particular grading has been asked in your exam already, so it's a very important name. I can see lot of C's. Patidhar, Suvo, Ranjan, Dipanshu, Aman, TJ, Anirudh, Sakshi, everybody is saying C. Yes, C is the correct answer. Okay, challenge. अब challenge वाला आता है. बताओ ये वाला कब यूज होता है? When is the ham grading used? बताओ. Ham grading is used for which condition? Anybody? गलती से मिस्टेक हो गया. Yes, गलती से मिस्टेक हो गया. तो दीपांशु ये बता दो, पश्चाताप करो, अब बताओ ये हैम ग्रेडिंग कब यूज होता? नहीं, नॉट इन्वर्टेड पैपिलोमा, Ham grading is used for esthesioneuroblastoma. Ham grading is used for esthesioneuroblastoma. और the name is important, बहुत important नहीं है, अभी तक किसी भी एग्जाम में आया नहीं है. They've never asked this name in any exam, but still if you want to know, I'm telling you. Then House-Brackman grading, anybody knows about this one? House-Brackman grading, anybody? This is used for facial palsy in ENT. फेशियल पैल्सी की ग्रेडिंग इससे हो सकती है. क्लिनिकल ग्रेडिंग, सी फेशियल पैल्सी की ग्रेडिंग दो होती है. वन इज ए क्लिनिकल ग्रेडिंग, जैसे मतलब क्लिनिकल मीन्स पेशेंट के फेस को देख के आप बता सकते हो ग्रेड 1 है कि ग्रेड 2 है कि ग्रेड 3 है या ग्रेड 4 या ग्रेड 5 है. दैट बाय लुकिंग एट द फेस ऑफ द पेशेंट, कौन से मसल मूवमेंट है, कितना मूवमेंट है, ऑल दैट यू नो. सो दैट्स हाउसमैन-ब्रैकमैन. द सेकेंड वे ऑफ डूइंग फेशियल पैल्सी की ग्रेडिंग इज बेस्ड ऑन इलेक्ट्रोकॉक्लियोग्राफी, इलेक्ट्रोन्यूरोनोग्राफी. इट्स इन्वेस्टिगेशन, नर्व स्टिमुलेशन टेस्ट बोलते हैं उसको, उससे भी ग्रेडिंग होती है. सो देयर टू वेज ऑफ डूइंग द ग्रेडिंग ऑफ फेशियल पैल्सी. वन ऑफ देम इज दिस वन, हाउस-ब्रैकमैन. Mayan cotton grading I told you is subglottic stenosis, and modified Malapatti, anybody knows? ENT, I think you will know. Many people will, because they teach in this one, they teach in anesthesia sometimes. Anesthesia में ये कई बार पढ़ाते हैं. इंट्यूबेशन करने के टाइम पे ये ग्रेडिंग कई बार काम आती है. When you try to intubate the person, then sometimes this is used. This is size of palate, size of soft palate. So उसके वजह से airway left, how much airway is left, कितना airway, क्योंकि palate बड़ा होगा तो airway छोटा पड़ जाएगा. So it is based on that intubation के लिए. So yes, so many of you have idea about this, about facial nerve injury. Patidhar answered that, Sahani answered that, and intubation के बारे में बहुत लोगों को पता था. रंजन, पतिधर, दीपांशु, शुभो, साक्षी. So lot of you know about this. Yes, correct. So you have a fair amount of idea about this. Then next one, a 45-year-old woman who has undergone a total thyroidectomy procedure and has been shifted to post-op ward. 2 hours later, so she has thyroidectomy surgery. 2 घंटे के बाद she developed stridor and dyspnea, but her voice is normal. So which of the following vocal cord lesion is most likely to cause, is the likely cause for a condition? Unilateral abductor palsy, bilateral abductor palsy, unilateral complete palsy, bilateral complete palsy. So what is your answer, guys and girls? Let's see. Young doctors, answer this one. Who wants to answer this question? I can see Amani saying B, Ranjani saying B, Vipul Shukla is saying B, and so many people saying B, Pankaj saying B. इतने लोग बोलेंगे तो उसको मानना ही पड़ेगा. डेमोक्रेसी है ना, इंडिया में डेमोक्रेसी है. Patidhar, Dr. Patidhar, VM Patidhar, I want to make a correction. This is not in the choices, but he's saying bilateral recurrent laryngeal nerve complete palsy. Now the word complete is a wrong answer. Wrong answer. Okay, incomplete में होता है, not incomplete. So I'm addressing Dr. Patidhar, VM Patidhar. That word complete is a wrong answer in that incomplete में होता है. I know it is given in many MCQ books. बहुत सारे MCQ books. There are people who are teaching also that this happens in complete palsy of the recurrent laryngeal nerve on both the sides. Bilateral recurrent nerve, complete palsy. That is a wrong information you are getting from your MCQ book and other faculties. It is incomplete recurrent laryngeal palsy on both the sides. That is the correct answer. Anyways, so see, this abductor palsy is due to recurrent laryngeal nerve palsy, and complete palsy is due to either vagus or both nerves. Both nerve means recurrent laryngeal nerve प्लस सुपीरियर लैरिंजियल नर्व, दोनों एक साथ जाएंगे तो कंप्लीट पैल्सी बोलते हैं, और सिर्फ रिकरेंट जाएगा तो उसको अबडक्टर पैल्सी बोलते हैं. ओके, नाउ सी, ब्रॉडली I will divide facial palsy, vocal cord palsy into abductor palsy. I told you is due to recurrent nerve palsy, है ना, ये मैंने अभी बताया आपको. Recurrent nerve palsy causes abductor palsy, and it can be vagus palsy, which is both the nerves, recurrent and superior. It is called abductor palsy. इसका दूसरा नाम abductor palsy है. It is also called complete palsy, क्योंकि सारे कुछ गया ना, अगर सारी नर्व गई, वेगस गया, सब कुछ गया तो कंप्लीट पैल्सी बोलते हैं. ना कीप दिस नेम इन माइंड, ये नाम याद रखना. कंप्लीट पैल्सी इज अडक्टर पैल्सी, ये याद रखना. आई टेल यू व्हाई दिस इज इंपॉर्टेंट. इट इज ऑल्सो कॉल्ड वेगस पैल्सी और बोथ पैल्सी, सारी पैल्सी, सब कुछ गया तो कंप्लीट पैल्सी. ना ईच वन कैन बी डिवाइडेड इनटू यूनिलैटरल, बायलैटरल. इन अ यूनिलैटरल abductor palsy, the main complaint is hoarseness, change of voice, which becomes normal within few days. Okay, इसकी अभी हम बात करेंगे. In unilateral adductor palsy, again it is hoarseness प्लस माइनस एस्पिरेशन. एस्पिरेशन भी हो सकता है, लेकिन मेनली हॉर्सनेस. इन द लास्ट वन, एफोनिया. एफोनिया मीन्स कंप्लीट लॉस ऑफ वॉइस प्लस माइनस एस्पिरेशन. राइट. सो 4 टाइप की पैल्सी होती है, उनमें से 3 में वॉइस इज द मेन कंप्लेंट. इसमें भी वॉइस गया, इसमें भी वॉइस गया, इसमें भी वॉइस गया, एंड द क्वेश्चन से द वॉइस इज नॉर्मल. तो ये 3 हो ही नहीं सकता, सिंपल है, यही बचा है ना, बाकी सब में वॉइस. नाउ व्हेन इट कम्स टू बायलैटरल रिकरेंट नर्व पैल्सी, इट इज वेरी इंटरेस्टिंग. Bilateral recurrent nerve palsy can be partial or complete. So this is what I was telling you. Now complete palsy, again it is hoarseness. इसमें भी hoarseness होता है. So all these conditions that you see on the screen till now, they all have hoarseness. The only condition that does not have hoarseness is this one, where there is dyspnea, means stridor, with good voice. This is the only condition where the voice is good and there is dyspnea. So question में यही दिया था, उसको dyspnea and stridor है, voice is good, है ना. So this is the answer. Okay, this is the best answer. Since partial palsy नहीं दिया हुआ, in the choices bilateral abductor palsy दिया हुआ है. So bilateral abductor palsy is the correct answer. If they give you more difficult question, they can give you partial abductor palsy of both sides or complete abductor palsy of both the sides. Then partial will become a correct answer. Okay. Now don't get confused. Complete bilateral palsy of the recurrent nerve versus complete palsy only, which is the other name for adductor palsy. तो यहां पे भी complete लिखा हुआ है यहाँ पे भी कंप्लीट. सो बी केयरफुल व्हेन दे यूज द वर्ड कंप्लीट. कौन सी कंप्लीट की बात करें? कंप्लीट रिकरेंट नर्व पैल्सी या कंप्लीट पैल्सी? तो वन इज कंप्लीट recurrent laryngeal nerve palsy and one is just complete palsy. So if I just tell you complete palsy, then I'm talking about this one. But if I talk about complete recurrent nerve palsy, then I'm talking about this one. है ना? इतना ध्यान रखना. So the only condition of vocal cord palsy जहाँ पे voice ठीक ठाक होती है वो ये bilateral partial palsy of the recurrent nerve. And I repeat what I told you थोड़ी देर पहले कि हर बुक में, हर ऐप में जब ये बताते कि विच इज द मोस्ट डेंजरस पैल्सी, बिकॉज दिस इज द मोस्ट डेंजरस डिस्निया, सब में आंसर ये वाला दिया हुआ है, विच इज नॉट द करेक्ट आंसर. पार्शियल पैल्सी इज द करेक्ट आंसर. ओके, डन. सो लेट्स सी, देयर इज अ क्वेश्चन. सर अगर क्वेश्चन में सीवियर रेस्पिरेटरी डिस्ट्रेस दिया हो तो भी कंप्लीट पैल्सी नहीं. सीवियर रेस्पिरेटरी डिस्ट्रेस दिया हो तब भी यही आंसर आएगा. अगर सीवियर रेस्पिरेटरी पैल्सी दिया हो तो भी ये आंसर आएगा. ओके, लेट मी एक्सप्लेन दिस सो दैट यू कैन रिमेंबर इन फ्यूचर ऑल्सो. आगे भी याद रहेगा. सी, लेट मी एक्सप्लेन दिस. See, recurrent laryngeal nerve supplies one abductor called posterior cricoarytenoid. मैं पूरा नाम नहीं लिख रहा because it's a discussion class. PCA is posterior cricoarytenoid and it supplies 3 adductors. Which are the 3 adductors? Lateral cricoarytenoid, interarytenoid, thyroarytenoid. The only nerve it does not supply, the only muscle of the larynx it does not supply is cricothyroid. Cricothyroid is a main tensor. इसका काम टेंशन है मेनली. तो ये अडक्शन अबडक्शन में काम नहीं करता, बट वीक अडक्टर है, बट मेन काम इसका टेंशन है. दैट मीन्स रिकरेंट नर्व के अंदर ये वाले फाइबर्स है, अबडक्टर और अडक्टर्स. देयर वाज अ जेंटलमैन कॉल्ड सिमन. ही गेव अ लॉ कॉल्ड सिमन्स लॉ. So what does Simon's law say? He said, अगर आप रिकरेंट नर्व को काटोगे, सपोज दिस इज द कट एंड ऑफ द रिकरेंट नर्व, आपने काट के देखा रिकरेंट नर्व को, तो इस नर्व के अंदर अबडक्टर के भी फाइबर भी है, अडक्टर के फाइबर भी है. इट इज कंटेन बोथ द फाइबर्स. बट व्हाट इज सेड दैट इन द सेंटर ऑफ द नर्व आर द अडक्टर फाइबर. अंदर अडक्टर है and bahar abductor fiber. Outside, on the outer side, here are the abductor fiber. Right? This is what Simon said. कि इस तरह से अरेंज्ड फाइबर्स है, मिक्स नहीं है, ग्रुप है. अंदर अडक्टर वाले मिले हुए, चारों तरफ से अबडक्टर्स ने उनको घेरा हुआ है. एंड देन इट सेज दैट कोई भी डिजीज है बाहर से जाती है. दिस इज अ डिजीज, ये डिजीज है, बाहर से अंदर जाएगा, इन्फ्लामेशन बाहर से अंदर जाता है, ट्यूमर बाहर से अंदर जाता है. सो व्हेन द नर्व डिजीज गोज आउट इनसाइड, फर्स्ट अबडक्टर्स आर गॉन. अब इसी पार्शियल पैल्सी है, पार्शियल पैल्सी में पूरी नर्व डैमेज नहीं हुई है, अडक्टर्स स्टिल फंक्शनिंग. और अडक्टर्स क्या करेंगे? अडक्ट करेंगे. अडक्शन मीन्स इफ दीज आर द वोकल कॉर्ड्स, इफ यू कैन सी माय फिंगर, ये वोकल कॉर्ड है. अडक्शन मीन्स दोनों बीच में आ जाएंगे, मिल जाएंगे. अडक्शन मीन्स कम इन द मिड लाइन. अब मिल गए, सांस लेने की जगह नहीं है, अडक्शन हो गया, सिर्फ अडक्शन बचे हुए. दे विल पुल द अडक्शन एंड दिस इज डिस्निया. दिस इज गोइंग टू कॉज सीवियर रेस्पिरेटरी ब्रीदिंग, डिस्निया, स्ट्राइडर, जो भी बोल लो, लाइफ थ्रेटनिंग. सो दिस इज partial palsy of the recurrent nerve adductor. और जब कंप्लीट पैल्सी हो जाएगी, सब चले जाएंगे तो दोनों चले जाएंगे, और अडक्शन अबडक्शन दोनों नहीं होगा, ना अडक्शन नो अबडक्शन, तो बीच में आ जाएगा लाइक दिस, बीच में अब सांस लेने की जगह आ गया, इसलिए वॉइस विल बिकम बैड, देयर इज नो डिस्निया। आर यू गेटिंग द पॉइंट? सो पार्शियल abductor palsy on both the side is the most dangerous recurrent nerve of the vocal cord palsy का situation, and this was explained by this gentleman called Simon. It is based on Simon's law. इसलिए मैं बोल रहा हूँ कि हर बुक में, हर MCQs में, हर ऐप में कंप्लीट पैल्सी दिया हुआ है, which is a wrong answer. And if you, this is the proof. I'm telling you the reason also, why, the logic behind this answer, in case you want to know. Okay, done? I hope it is correct. The next one, a patient complains that he feels like the room is spinning when he gets up from lying down position. He has no history of loss of consciousness. Which of the following could be probable diagnosis? BPPV, Ménière's disease, labyrinthitis, syncope. I think everybody knows this answer. Syncope is blackouts. This is decreased blood supply to the brain. ऑर्थोपनिया वगैरह में होता है ये, ऑर्थोपनिया हो गया, ब्लड सप्लाई उसमें होता है। लैबिरिंथाइटिस एंड मेनियर डिजीज में दोनों में SNHL इज द मेन सिम्टम प्लस माइनस वर्टिगो। सो व्हेन द पेशेंट इज गेटिंग अप एंड देन ओनली देयर इज अ वर्टिगो, इसको बोलते हैं पोजिशनल वर्टिगो। दिस इज कॉल्ड पोजिशनल वर्टिगो, and positional vertigo is a feature of BPPV, benign paroxysmal positional vertigo. So Aman, Suvo, Ranjan, Sakshi, Patidhar, Anirudh, Vipul, so everybody got it right. Now these are the other points about BPPV. You can, I told you the BPPV patient has positional vertigo lasting for few seconds, less than 20 seconds. लेकिन BPPV में जो सबसे इंपॉर्टेंट दो नाम एग्जाम में पूछते हैं, वन इज दिस डिक्स हॉलपाइक मनूवर, विच इज मनूवर फॉर डायग्नोसिस ऑफ BPPV. ये मनूवर बहुत इंपॉर्टेंट MCQ आता है. एंड एप्लेस मनूवर is another very important maneuver which is for the treatment of BPPV. So these two maneuvers are the most important names in BPPV they ask in the exam. Both, one is for diagnosis, one is for treatment of BPPV. Which of the straightforward simple question, which of the following comprises the larynx? Larynx में कितने cartilage है? Everybody knows. I don't have to wait here. 3 unpaired, 3 paired, है ना? So these are the names of the 3 unpaired cartilage. Cricoid, thyroid, epiglottis are the unpaired cartilage, and 3 paired cartilage, arytenoid, cuneiform, corniculate. It's a very simple thing. कई बार when they want to ask a very simple question, they will ask you this kind of, एक क्वेश्चन आता है, बहुत बार आता है कि which of the following is a unpaired cartilage. ये नाम देंगे उसमें से एक unpaired होगा. Which of the following is a paired cartilage, like that. So yes, B is the correct answer. 3 paired, 3 unpaired. Yes. What is the length of external auditory canal? Again, very straightforward question. External auditory canal is 24 millimeters. 36 is the length of what? Length of eustachian tube. Eustachian tube की length 36 होती है, external auditory canal की 24 millimeters. So these are simple straightforward questions. आपके एग्जाम में ऐसे क्वेश्चंस बहुत होते हैं. यूजुअली हमें आसान क्वेश्चन जो हमें आते हैं वो याद नहीं रहते, जो मुश्किल क्वेश्चन है, डिफिकल्ट है, जो आपसे नहीं हुआ वो याद रहते और उसी का रोना रोते रहते हैं. अरे वो क्वेश्चन आया था, समझ नहीं आया, उसी को डिस्कस करते रहते हैं. बट यू डोंट रिमेंबर कि अगर मान लो आपका 45%, 46% आया था तो आपने कितने सही का आंसर लगाए थे, तभी तो इतने परसेंट आए थे, है ना. देन अ 30-year-old man presented with finding which he noticed when he woke in the morning. मतलब ये इसको सुबह दिखा, जो इमेज दिखा रहे हैं. This is how it look. There is no history of fever or rash. A panel of investigation was done and were found to be normal. So which is the false regarding the treatment? So this is Bell's palsy. What is Bell's palsy? Bell's palsy is idiopathic facial nerve palsy. Because the findings are normal, it is idiopathic, finding पता नहीं है, and you can make out there is a Bell's palsy of this side. इस तरफ की आंख बंद नहीं हो रही, कुछ नहीं हो रहा. So this side is Bell's palsy. So basically they are asking you which of the following is not done in Bell's palsy. Physiotherapy of the muscle, it is done. Steroids are not contraindicated, they are indicated. It's the main drug in this patient. Acyclovir is useful, is true. Surgical decompression immediately नहीं करते, obviously सर्जरी थोड़ा कर देंगे एकदम से. And permanent thyroplasty भी immediately नहीं करते. So which is not done? This is not done, this is not done, this is not done. So 2, 4, 5 is the correct answer. 2, 4, 5 also. टार्सोग्राफी बहुत लेट करते हैं, बहुत लास्ट में करते हैं, जल्दी से नहीं करते. So B is the correct answer. So this is one question, C is the correct answer. This is one question where a lot of people got it wrong. Okay. टार्सोग्राफी की दोनों आईलिड्स को आपस में सूचर कर देते हैं ताकि ड्राइनेस, बिकॉज आंख बंद नहीं हो रही उसकी, ड्राइनेस हो जाती है, एक्सपोजर केराटाइटिस हो सकता है, तो उसको सूचर कर देते हैं. लेकिन जल्दी से नहीं करते. यूजली व्हाट यू डू इज, उसको पेशेंट को बोलते हैं कि पानी ईयर आई ड्रॉप्स डालते रहो दिन में 5-6 बार, उससे वेट रहेगा, मॉइस्चर रहेगा. एंड सोते वक्त आँख के ऊपर कोई गर्म कपड़ा, गॉज पीस, वेट द गॉज पीस ऊपर रख दो तो मक्खी की भी नहीं बैठेगी. यू नो इट्स कवर्ड. टेप कर दो लगा के, रात भर सोते वक्त वो लगा दो, दिन में ड्रॉप डालते रहो, तो टार्सोग्राफी की जरूरत पड़ती नहीं है. जल्दी से नहीं करते इस पेशेंट को. सो सी इज द करेक्ट आंसर. नाउ दिस इज वेरी वेरी इंपॉर्टेंट, दिस स्लाइड. सी Bell's palsy, how do you treat? We start with steroid in the beginning for 2 to 3 weeks. This is the beginning of the treatment. And steroid के साथ acyclovir भी दे सकते हैं. Now if there is no response, then we do electroneuronography investigation. Electroneuronography palsy को ग्रेड करता है. Remember I told you grading पैल्सी दो तरह से. क्लिनिकल ग्रेडिंग का नाम मैंने बताया था, हाउस एंड ब्रैकमैन ग्रेडिंग, वो क्लिनिकल ग्रेडिंग है. ये इलेक्ट्रॉन, ये नर्व स्टिमुलेशन टेस्ट की ग्रेडिंग है. इसमें भी 5 ग्रेड होते हैं. इफ इट इज ग्रेड 1, 2 और 3 लेस सिवियर, देन चांसेस ऑफ रिकवरी इज मोर देन 90%. 90% चांस है कि ठीक हो जाएगा, तो स्टीरॉयड ही लगा के रखते हैं, वी डोंट चेंज. बट इफ इट इज ग्रेड 4 और 5 विच इज मोस्ट सिवियर डैमेज, देन इट विल नॉट रिकवर. 10% से भी कम चांस है कि ठीक होगा, तो डीकम्प्रेशन सर्जरी करते हैं. सो नाउ दिस स्लाइड इज वेरी वेरी इंपॉर्टेंट. इसमें से क्वेश्चन बहुत कॉमनली आते हैं. फेशियल पैल्सी, इसको घोंट के पी लेना इज सो इंपॉर्टेंट, राइट. देन विच ऑफ द फॉलोइंग ऑप्शन इज सिनोनिमस विद क्विंसी. क्विंसी का दूसरा नाम हम कर चुके हैं, पेरिटॉन्सिलर एब्सेस. सो आई विल नॉट वेट हियर. अ यंग बॉय with a history of frequent nosebleeds and unilateral block. Nosebleed frequent, बार बार हो रहा है. हॉलमैन मिलर साइन, मैंने बताया था पहले एक क्वेश्चन में, चॉइसेस में था. हॉलमैन मिलर साइन इज अ फीचर ऑफ JNA, जुवेनाइल नेजोफेंजियल एंजियोफाइब्रोमा. और JNO में यही होता है. इससे यंग बॉय, यूजुअली बॉय होता है, और ब्लीडिंग होती है उसको नाक से. इट शोज दैट प्रेजेंस ऑफ mass in the nasopharynx that extend into the pterygopalatine fossa, which is the best treatment for this patient. Every JNA is a benign vascular ट्यूमर, और कोई भी बेनाइन ट्यूमर में कहीं पे भी इफ पॉसिबल सर्जरी इज ऑलवेज द बेस्ट ऑप्शन. बेनाइन ट्यूमर में सर्जरी दिया तो वही हो सकता है. सो सर्जिकल मैनेजमेंट without any doubt is the best treatment. This is true for every benign tumor. But let me tell you, कुछ ऐसे benign tumor होते हैं जहाँ पे सर्जरी हो नहीं सकती किसी वजह से. Then it's a different thing. If surgery is possible, you always do surgery always. That brain tumor, acostinoderma, again best treatment is surgery. उसमें भी वो भी benign tumor है. But these are the other points about JNA. See, JNA की history हमेशा ऐसे होती है. It's usually a 13-year-old young male. See, young male with recurrent epistaxis. So if you and similar history was there. Along with that, there could be cheek swelling, there could be proptosis, there could be nerve involvements, there could be glue. And two signs. Which are the two signs possible? One is called frog face and the other is called antral sign. Antral sign को Hallman-Miller sign भी बोलते हैं. So this was also given in the book. Hallman-Miller sign is given in the choices. So from here we know it is angiofibroma surgery. Which of the following conditions is classified using Ongrain's line? Ongrain's classification: maxillary sinusitis, frontal sinusitis, maxillary carcinoma, frontal carcinoma. So what is the answer in this case? Ongrain's line, Ongrain's classification इनमें से किसके लिए यूज होता है? Ongrain's line is a line that can be drawn from medial canthus of the eye. अगर आई के medial canthus to angle of mandible, if you draw a line from medial canthus to the angle of mandible, this line is called Ongrain's line. Okay, and I can see a lot of people saying C. Patidhar, Aman, Ranjan, Suvo, Anirudh, Vipul, C. C is the correct answer. It is for used for maxillary carcinoma. ये question आपके एग्जाम में आ चुका है. It's a FMG question. Now this line that you see is the Ongrain's line. ये yellow line Ongrain's line है. In this, if I draw maxilla, maxilla can be drawn like this. So this line divides the maxilla. Above the line is called suprastructure of maxilla. And below the line is the infrastructure of the maxilla. इसको बोलते हैं infrastructure. Now suprastructure carcinoma has good prognosis, and infrastructure carcinoma has poor. उल्टा हो गया. Oh my God. This has poor prognosis. This has good prognosis. Suprastructure carcinoma has poor prognosis. Infrastructure carcinoma has good prognosis. So basically, Ongrain's line maxillary carcinoma की prognosis बताता है. Okay. अभी मैंने रिसेंटली क्लास लिया है कैलकाटा में, मैंने उल्टा बोल दिया, अभी याद आया मेरे को. क्या है, समटाइम्स दिस थिंग्स हैपन. दिमाग में कुछ है, जुबान में कुछ और निकल जाता है, क्या करें. दिस सिंपल क्वेश्चन. You are an intern in ENT department preparing the alkaline nasal solution for a patient in atrophic rhinitis. In atrophic rhinitis, one of a very important treatment is called alkaline nasal douche. Many of you will know douche is a Russian word which means shower or cleaning. So we clean the nose with alkaline solution in atrophic rhinitis. तो दे आस्किंग कि उस सोल्यूशन को बनाने के लिए 3 सॉल्ट यूज होते हैं, इनमें से एक नहीं होता. सो विच इज द सॉल्ट दैट इज नॉट यूज? इट्स वेरी सिंपल. कई बार कंफ्यूजन हो जाता है. कंफ्यूजन होता है अगर बोरेट है, बाइबोरेट है, क्लोराइड है, बारकार्बोनेट कौन सा है. लेकिन व्हाट इज नॉट कंफ्यूजिंग एवर इसकी दे आर ऑल सोडियम सॉल्ट. पोटेशियम यूज नहीं होता, कोई पोटेशियम का सॉल्ट यूज नहीं होता. सो इफ दे गिव यू सोडियम बोरेट, सपोज सोडियम बोरेट दे देंगे instead of biborate, so that is a not use. Biborate is used. So confusion ऐसे में हो सकता है, but not in such simple questions. So everybody got it. B. प्रलय सहा आ गया. B. पहली बार आंसर दिया शायद. प्रलय, I think this is your first answer. Good. Okay. Now these are the points about atrophic rhinitis. Atrophic rhinitis has many causes. So most common cause is estrogen decrease. उस केस में एस्ट्रोजन का स्प्रे दे सकते हो। अगर विटामिन डी डिफिशिएंसी की वजह से तो विटामिन डी का सप्लीमेंट दे सकते हो। अगर क्लेप्सिला की वजह से है तो स्ट्रेप्टोमाइसिन दे सकते हो। दी आर द फीचर्स: रूमी कैविटी, ड्राई कैविटी, क्रस्टिंग, फाउल स्मेलिंग, एनॉस्मिया. Nasal block is the main complaint of this patient. It can have merciful anosmia also, और alkaline nasal douche कर सकते हैं. इसके कंटेंट मैंने अभी आपको बताया. क्वेश्चन वाज अबाउट दिस वन, ट्रीटमेंट. So these are the points about atrophic rhinitis that you might want to remember. Now this is straightforward, simple question. Cough on scratching the external acoustic canal is due to कौन सी नर्व की वजह से कॉफिंग होती है? इफ यू डू समथिंग इन द कैनाल, इज इट द ऑरिकुलर टेम्पोरल नर्व, ऑरिकुलर ब्रांच ऑफ द वेगस नर्व, ग्रेटर ऑरिकुलर नर्व, या फेशियल नर्व? सो व्हाट इज द आंसर? सिंपल क्वेश्चन, आई थिंक एवरीबॉडी विल गेट दिस राइट, है ना? दिस इज ड्यू टू पतिधरी सेइंग बी. इसका दूसरा नाम है आर्नोल्ड्स नर्व. दिस इज द अदर नेम फॉर दिस सेम नेम, आर्नोल्ड्स नर्व, है ना? सो बी, यस, पतिधर, अमन सिंह, हसन, अनिरुद्ध, शुक्ला जी, शिवू, साक्षी, अनोवर, हुसैन मलिक, शानाया, अनिरुद्ध. So everybody got it correct. Vegas. Simple. These are the other nerves in the canal. वो जहाँ पे canal है, Arnold's is the cause of cough. But the other nerves in the canal, auriculotemporal nerve भी है, facial nerve भी supply करता है, lesser occipital nerve. These are the nerves supplying the pinna and एक्सटर्नल ऑडिटरी कैनाल. ये नर्व सारी होती है, इसकी वजह से प्रॉब्लम होती है कॉफिंग. नेक्स्ट, अ पेशेंट विथ फैमिली हिस्ट्री ऑफ nasopharyngeal carcinoma presented with nasal discharge and a painless lump in the upper neck. On posterior rhinoscopy, where will you most commonly expect to find the mass originating from? Basically they are asking you the most common site of nasopharyngeal carcinoma, है ना? सबको पता था nasopharyngeal carcinoma arises from where? बताओ, where does nasopharyngeal carcinoma arise from? Fossa of Rosenmuller. This is NP carcinoma, and sphenoplateral foramen is a site of JNA, जुवेनाइल नेजोफेंजियल एंजियोफाइब्रोमा, वो स्फेनोप्लेटेन फोरामिन से अराइज होता है. एंड क्रेनियोफेरेंजियोमा arises from Rutgers pouch. These are all tumors of nasopharynx. सो नेजोफेरिंग्स में ये 3 ट्यूमर होते हैं, और मैंने एक स्लाइड में आपको तीनों की स्लाइड बता दी. ओके, now what is fossa of Rosenmuller? Now look at this structure marked. This is nasopharyngoscopy. So this is nasopharyngoscopy. ये yellow area they asking you, and that is the fossa of Rosenmuller. वहीं से कार्सिनोमा निकलता है. This is eustachian tube का opening. This arrow is FOR. FOR means fossa of Rosenmuller. और ये बल्ब जो है इसको टॉरस ट्यूबेरिस बोलते हैं. this bulge is torus tubaris. सो सबसे सामने स्टेशन टिप की ओपनिंग होती है नेजोफेरिंक्स में, उसके पीछे एक बल्ज होता है टॉरस ट्यूबारिस, उसके पीछे होता है फॉसा फ्रोजुमुलर जहां से कार्सिनोमा निकलता है. नाउ डॉक्टर शनाया, साइनोडुरल एंगल क्या आप, व्हाट इज दैट, व्हाट आर यू टेलिंग अस समथिंग, आर यू आस्किंग समथिंग, is there something here that you are asking? No. So can you please tell me what are you trying to say or ask? साइनोडुरल एंगल लिखा आपने, उसके बारे में कुछ पूछना है कि उसके बारे में आप कुछ बता रहे हैं हमें जो हमें नहीं पता? प्लीज एलाबोरेट. सो ये नेजोफेरिंगोस्कोपी का इमेज आपके एग्जाम में आया था 2023. इन 2023 there was a MCQ image based question. They shown the image like this of a nasopharynx, and in that question also they asked the same question. They pointed at the fossa frojunular and they asked कि ये क्या है, please identify this fossa frojunular. So this is the same question which is being repeated basically. Now these are the other points about nasopharyngeal carcinoma. So like you can see, nasopharyngeal carcinoma arises in the fossa frojunular. We know this already. The type of carcinoma is undifferentiated squamous cell carcinoma. दो अलग अलग एज ग्रुप में होता है. It is bimodal. Bimodal means two different age groups. Either it is seen in a child less than 20 years. Look at the question. If you look at this question, present family on the posterior. अच्छा, इसमें चाइल्ड मेंशन नहीं था. ओके, आई थॉट इसमें चाइल्ड मेंशन है. एनीवेज, सो आइदर इट इज सीन इन अ चाइल्ड लेस देन 20 years or it is seen after 40 years of age. 3 causes. The most important cause is Epstein-Barr virus. आपको ये वाला याद रखना. It's a very very important MCQ. Which virus can cause nasopharyngeal carcinoma? Epstein-Barr virus. But along with that, it can also be caused due to nitrosamine and genetics. ये चाइना में ज़्यादा होता है, चाइनीज पीपल में. And presentation. The most common presentation is cervical lymphadenopathy. Along with cervical lymphadenopathy, there can be serous otitis media, because of which there can be hearing loss. Epistaxis can happen. Nerves can get involved. And there is a triad called Trotter's triad. And they also ask you कि Trotter's triad में क्या क्या होता है? Short palate palsy, facial pain, and hearing loss. All the 3 are features of Trotter's triad. And treatment, chemoradiation. Nasopharyngeal carcinoma is a very very important carcinoma from the ENT point of view, from your exam point of view. इसको ध्यान से अच्छी तरह से याद रख लेना. Okay. So this slide and the previous slide gives you all the important information about this particular carcinoma. Next one. A 40 years old woman came to OPD with complaints of bilateral nasal obstruction, headache, sneezing and nasal discharge. So नाक में कुछ है, nasal discharge, headache है with nasal obstruction. On examination, multiple smooth, pale, glistening masses are present. Multiple pale, shining, glistening masses are present in both the noses that do not bleed on touch. Remember, that do not bleed. मैंने बोला था ना, नाक में सिर्फ एक चीज है जो ब्लीड नहीं होती. So what is that thing? So if you know this, because I have told you कि नाक में सिर्फ एक चीज है जो ब्लीड नहीं होती, which is nasal polyps. So I know it is nasal polyp. So which is false about the diagnosis about this conspiracy? Allergy is a etiological factor. Site of origin is lateral wall of the nose. Face is the treatment of choice. The mass can grow posteriorly and occupy quena. So nostril polyp तो ठीक है. आंसर बताओ इसका. So वो is saying C. C. FES not done in nasal polyp. Nasal polyp का treatment of choice is FES. I'll tell you a hint. Hint is bilateral. Bilateral and AIDS. ये दो चीज आपको हिंट दे रही है. पॉलिप नहीं है, पॉलिप है ये पता चल गया बिकॉज इट्स नॉट ब्लीडिंग, सो पॉलिप है. नाक में ये चीज ब्लीड नहीं होती, पॉलिप. Origin is ethmoidal sinus and ethmoidal sinus is the lateral wall of the nose. Lateral wall of the nose ethmoidal sinus से ही बनता है, ethmoid से ही बनता है. तो if you say lateral wall of the nose and ethmoid, it is same thing. Lateral wall of the nose is mainly 90% is ethmoidal bone, ethmoidal sinus. So saying lateral wall of the nose and saying ethmoidal sinus is same thing. Okay, we'll come to this. Look here. Nasal polyp दो तरह के होते हैं, maxillary polyp, ethmoidal polyp. अडल्ट में ethmoidal polyp होता है, बच्चों में maxillary polyp होता है. तो ये पेशेंट की 40 इयर्स है तो ethmoidal polyp है. ओके, नॉट maxillary polyp. एंड maxillary polyp यूनिलैटरल होता है, ethmoidal polyp bilateral होता है. दिस इज bilateral, this is also telling you ethmoidal polyp. Basically it is a ethmoidal polyp. But before we go to the question, because ethmoidal polyps are multiple, they are called bunch of grapes. Multiple होते हैं ethmoidal. Maxillary polyp single होता है. Ethmoidal polyp is recurrent and दोनों में फेस करते हैं. But maxillary polyp because it is infective in nature, एंटीबायोटिक देते हैं. Ethmoidal polyp is allergic in nature, जिसमें स्टीरॉयड देते हैं. Right. So how many points are telling you it is ethmoidal polyp? A's, bilateral and multiple. तीन बातें ये बता रहा है कि this is ethmoidal polyp. Okay. Ethmoidal polyp arise from the ethmoid, which is lateral of the nose. Allergy you already know is the main site and FES is done. ये भी सही है, ये भी सही है, ये भी सही है. तो D is the correct answer. See, maxillary polyp is also called enterochoanal polyp. Maxillary polyp को enterochoanal polyp बोलते हैं because maxillary polyp क्वेना में ग्रो होता है, क्वेना में पीछे. Not ethmoidal polyp. Ethmoidal polyp क्वेना में नहीं जाता. So this is a ethmoidal polyp. So it cannot go posteriorly occupying the quena. That is true for maxillary polyp. Okay. That's why D is the correct answer. So this you can say is a slightly tough question. है ना, थोड़ा सा मुश्किल था, but lot of people could answer this question. I think Dipanshu answered, Anirudh, Patidhar, Hassan, Suvo, Shukla, Pandey, Pundev. So a lot of you could still answer, which is not a very easy question. So this was not only about polyp. Polyp तो पता चल गया कि bleeding नहीं हो रहा तो polyp है, लेकिन ethmoidal polyp ये कैसे पता चलेगा, उसमें तीन बातें थी. A's, multiple and bilateral. And ethmoidal polyp does not go to the quena. Maxillary polyp goes to the quena. Okay, once again. A 20-year-old female presented with features of bilateral conductive hearing loss, not associated with tinnitus. The following image shows the otoscopic finding. So ये image दिख रहा है, ये tympanic membrane है, उसके नीचे something red and something red coming from the floor of the ear like a sun is called rising sun sign. So this is rising sun sign of glomus tumor. This is glomus tumor की finding होती है, rising sun sign. So this is the correct answer. We discussed short sinus seen in otosclerosis. इस पे हमने एक क्वेश्चन डिस्कस कर चुके हैं. सेटिंग सन साइन ऑफ्थैल्मी होता है, not in ENT. And cartwheel appearance is ASOM, acute otitis media में होता है cartwheel appearance. So this is glomus tumor, rising sun sign. Now glomus tumor usually presents at this age group. Usually इसमें 20 था, but usually at this lady, वो भी lady थी, CHL. Along with CHL, the patient can have pulsatile tinnitus, ear bleed, and nerve involvement, and 4 signs possible. One of them is rising sun sign, वो एक choice था. Brown sign can be there, Phelps sign can be there, Aquino sign can also be there. And because glomus tumor is also a benign tumor, इसमें भी surgery करते हैं, surgery. Okay. So coming back to this, now if you look at the question, it's a female 20 years, hearing loss है दोनों कान में, tinnitus नहीं है. Now this could be, अगर history पढ़ोगे तो कुछ भी हो सकता है. Otosclerosis can be this, otitis media हो सकता है इसमें, glomus tumor हो सकता है. There's so many other diseases they can cause the similar history. So history सुन के diagnosis नहीं बनता. So in this case the image became important. Image देख के आपको पता चला कि ये glomus tumor है, and this finding is called rising sun sign. Okay, and these are the other features of glomus tumor that you can try and remember. Okay, which of the following is the most common symptom that acoustic neuroma presents with? Acoustic neuroma का सबसे common symptom क्या होता है? इसका मतलब कि सारे हो सकते हैं, है कि नहीं पता नहीं, लेकिन most common. Who will answer? Conductive hearing loss, sensory hearing loss, vertigo, headache. Which one? Anybody wants to answer this question? So B. VM Patidhar is saying B. This is an 8th nerve disease. In 8th nerve disease, conductive hearing loss can never happen. This is first and most common symptom. And so this is correct. These two are less common. They are both possible, but they are less common. So yes, B. B is the correct answer, not C. Okay. Vertigo इसमें बहुत late होता है. So see, the first symptom is tinnitus and SNHL, hearing loss. So ये आंसर में ये दिया हुआ था. First sign is loss of corneal reflex, and there is Histelberger sign also. ये 3 important findings होती है acoustic neuroma में. See, vertigo का mention नहीं है यहाँ पे. Vertigo थोड़ा late होता है. Headache का भी mention है. Headache हो सकता है, late होता है. Okay, this happens a bit late. They are not very common. So this was the answer. Now Histelberger sign in acoustic neuroma एक MCQ में choice में भी था. When SWOT sign की जब बात हो रही थी, I think one of the choices was Histelberger sign. उसमें मैंने बताया भी था कि Histelberger sign acoustic neuroma में होता है. So it's a very important sign of acoustic neuroma. Try and remember. Next one. Using impedance audiometry, stapedial reflex are being assessed in the child with the cranial nerve palsy. So which of the following cranial nerve is being tested? Basically, indirectly ये पूछे कि stapedial reflex में कौन सी cranial nerve यूज होती है, क्योंकि stapedial reflex को आप चेक कर रहे हो तो मतलब जो नर्व इसमें यूज हो रही है उसी को आप चेक कर रहे हो, और stapedial reflex को चेक करने के लिए हम impedance audiometry करते हैं. This is the name of the investigation that is used to check the stapedial reflex, and it will tell you about the nerves that are participating in this reflex. हर reflex में एक afferent nerve होती है और एक efferent nerve, कम से कम एक से ज़्यादा भी हो सकती है afferent and efferent. So at least one afferent nerve is present in every reflex, at least one efferent nerve is present in every reflex. So afferent is the 8th nerve and efferent is the 7th nerve. So 8th and 7th, C, as many of you rightly said, is a correct answer. So most of you could answer this correctly. Aman, Patidhar, Anirudh, Sanaya, Shubho, Ali Hassan, everybody. Good. Done. Impedance audiometry is the other name for tympanometry. Remember this. Tympanometry and impedance audiometry are same thing. ये एक ही चीज है, इनके 3 यूजेस होते हैं, 3 यूजेस. 1, diagnose middle ear diseases. मिडिल में कौन सी डिजीज है, एंड दैट इज बेस्ड ऑन द टाइप. अगर ए टाइप टिम्पैनोग्राम है तो नॉर्मल है मिडल ईयर. अगर ए एस है तो ऑटोस्क्लेरोसिस इज प्रेजेंट इन द मिडल ईयर. इफ ए डी है तो डिसरप्शन ऑफ ऑसिकल. अगर बी है तो सीरस ओटाइटिस मीडिया. अगर सी है तो स्टेशन ट्यूब ब्लॉक. So this is one of the things that tympanogram will tell you. Okay, so this is use number 1. Use number 2 is to diagnose eustachian tube problems. स्टेशन ट्यूब में प्रॉब्लम है कि नहीं है, वो यहीं से आ रहा है ना. अगर सी टाइप होगा तो स्टेशन ट्यूब में प्रॉब्लम है कि नहीं है, ये बता सकता है. And third is a stapedial reflex. It is used to do stapedial reflex. So if you want to check the stapedial reflex, then you have to do tympanometry. The tympanometry mainly 3 काम और भी होते हैं. इससे आपको थ्रेशोल्ड भी पता चल सकता है. You can also know the threshold of hearing. I'll add that. To know the threshold of hearing. So if you remember, अगर थ्रेशोल्ड 25 से कम होता है, जब एक ऑडियोग्राम था ना, उसमें 25 में लाइन बनाया था, मैंने कहा ऑडियोग्राम में 25 इज अ वेरी सिग्निफिकेंट लाइन. अगर ऑडियोग्राम उसके ऊपर होता है तो हियरिंग नॉर्मल होती है. अगर ऑडियोग्राम उसके नीचे हो जाता है तो हियरिंग लॉस होता है. तो उसको थ्रेशोल्ड बोलते हैं. 25 थ्रेशोल्ड ऑडियोग्राम से पता चलता है. सो मेन इन्वेस्टिगेशन टू फाइंड आउट द थ्रेशोल्ड इज द ऑडियोग्राम. लेकिन इससे भी पता, इट्स नॉट अ वेरी गुड, इसलिए इसका नाम मैंने लास्ट में लिख दिया है. इन चॉइसेस में अगर होगा तो यू माइट शुड नो एटलीस्ट कि इससे थ्रेशोल्ड पता कर सकते हैं, लेकिन इट्स नॉट अ वेरी गुड फॉर दैट, राइट. सो व्हेन आई कम टू दिस क्वेश्चन about stapedial reflex, if it is absent stapedial reflex, ये कब होता है? मेनली प्रॉब्लम आइदर 7th नर्व की प्रॉब्लम है, या 8th नर्व की प्रॉब्लम है, या स्टेपिडियस मसल की प्रॉब्लम है, या ऑसिकल्स की प्रॉब्लम है. मेनली इसके अलावा भी है, बट दीज आर द मेन 4 थिंग्स the disease of which can lead to absent stapedial reflex. But my question is, if stapedial reflex is absent, what is the name of that condition? उस situation का, उस condition का एक नाम है. So can anybody tell me the name of the condition in which the stapedial reflex is absent? Anybody? I'm waiting for your answers, guys. Let's see. If the stapedial reflex is absent, what is that condition called? It's called hyperacusis. hyperacusis. ENT में एक्यूसिस बहुत सारी है. There is hyperacusis, there is paracusis, there is presbyacusis, and diplacusis. बहुत सारे एक्यूसिस होते हैं. हाइपरएक्यूसिस एब्सेंट स्टेपिडियल रिफ्लेक्स, इसकी हमने भी बात की है. पैराक्यूसिस ऑटोस्क्लेरोसिस, याद है ना, मैंने बताया था. इसमें बेटर हियरिंग in noisy areas, I told you this. Presbyacusis, it can be defined as senile deafness. That means hearing loss due to old age. जो ओल्ड एज में हियरिंग लॉस हो जाती है हमारे बुजुर्गों को, उसको प्रेस्बायाक्यूसिस बोलते हैं. एंड डिप्लाक्यूसिस, डबल साउंड, हर वर्ड पेशेंट को 2 बार सुनाई देती है. एंड दिस इज अ फीचर ऑफ मिनियर्स डिजीज. सो जब वो मिनियर्स डिजीज वाला क्वेश्चन था उसमें भी मैंने आपको ये बताया था कि मिनियर्स के फीचर्स में वन ऑफ द थिंग इज डिप्लाक्यूसिस. सो दीज आर द 4 एक्यूसिस ऑफ ENT दैट यू कैन ट्राई एंड रिमेंबर. ओके, इजी. सो गाइज एंड गर्ल्स, अगर कोई और आपके पास सवाल है ENT से रिलेटेड, इफ यू वांट टू आस्क मी एनीथिंग अबाउट ENT, यू कैन आस्क मी नाउ. एनीथिंग अबाउट ENT. So these were the 30 questions and I try to cover most of the important topics. और जो टॉपिक ज़्यादा इंपॉर्टेंट है उसमें से मैंने एक से ज़्यादा क्वेश्चन रखे हैं. ओके, बट आई होप दिस सेशन वाज यूजफुल बिकॉज आई एम डन. सो आई होप दिस सेशन वाज यूजफुल एंड आई हैव अ फ्लाइट टू कैच टू हैदराबाद, तो इसलिए मैंने 5-7 मिनट जल्दी ख़त्म कर दिया. स्ट्राइडर के टाइप नहीं होता, स्ट्राइडर का फेज होता है. सी, स्ट्राइडर इज नॉइजी ब्रीदिंग. Stridor means noisy breathing. There are 3 types of stridor or 3 phases of stridor. One is called inspiratory stridor, one is called biphasic stridor, one is called expiratory stridor. Inspiratory stridor happens when there is a disease in the supraglottic. Examples: epiglottitis, example laryngomalacia. These are the 2 good examples of supraglottic disease causing inspiratory stridor. Biphasic stridor is glottic diseases. Glottic growths, example carcinoma, glottic carcinoma. Expiratory stridor is due to subglottic growth, example croup and subglottic stenosis. So I've told you the 3 types of stridor कब होता है. I've also given you the name of the important diseases जिसमें ये stridor होता है. Right? So I think this is what you are asking, Dr. Pativa. Is this your question? So guys, I will try to provide the PDF file. I'll try to make a PDF file. I'll share with the team and the team will share with you. Okay. So I really wish all the best for your exam. God bless you. And I want to see you next year. We'll together prepare for NEET PG exam next year. NEET PG and INI सेट एग्जाम का अगले साल मिलकर साथ काम करेंगे. उससे पहले आप मेहनत करके इस एग्जाम को क्लियर कर दो. अगले साल फिर से और प्रॉपरली और डिटेल्स में पढ़ाई करेंगे. ओके. नो, क्रूप डज नॉट यूजली हैव बाइफेजिक स्टार्टर. इट कैन हैव. सी सबग्लॉटिक में एक्सपिरेटरी एंड बाइफेजिक होता है. मेनली बाइफेजिक, लेकिन सबग्लॉटिक में दोनों हो सकते हैं. ओके. सो क्रूप कैन हैव बाइफेजिक ऑल्सो, बट इट्स मेनली एक्सपिरेटरी स्टार्टर. दैट इज ट्रू. डन. So bye guys.